Hi, this is Claire Antonioli, and today I'm going to talk with you about maximal voluntary contractions of wrist flexors and extensors for concentric, eccentric, and isometric contractions. Kudore et al. Found isometric, concentric, and eccentric conditioning yields differences in muscle properties such as muscle thickness, peak torque, and neuromuscular activity. Kay et al. And Kaleo et al. Have recorded MVC data for isometric, concentric, and eccentric contractions of the leg. However, there's not been much literature published on these conditions in the wrist. We chose to investigate the MVC of wrist flexors and extensors in isometric, concentric, and eccentric contractions. We hypothesized that the percent MVC will be the highest for concentric contractions, then eccentric contractions, and will be the least for isometric contractions for both wrist extensors and flexors. 8 volunteers were used from the DPT 703 class, with ages ranging from 22 to 34 years old, 3 males and 5 females. People were excluded from the activity if they had any adhesive allergies or if they had any pain in the motions required. We started by shaving the dominant forearm of the participant and then cleaning with an alcohol wipe. 2 electrodes were placed side by side on the muscle belly of both wrist flexors and extensors. Then 2 electrodes were grounded on the biceps. The subject was seated with the arm resting on the table and hand hanging off the edge. Total MVC was tested for both wrist flexors and extensors. Then MVC was recorded for isometric, concentric, and eccentric conditions. Using this data, the mean score was calculated as well as the standard deviation and the percent of MVC. Concentric contractions yielded the highest mean percent MVC for both wrist flexors and extensors. Eccentric and isometric contractions yielded approximately the same MVC for both wrist flexors and extensors. For all conditions, standard deviations were very large, indicating a large amount of variance in this study. Concentric contractions having the highest percent MVC is consistent with the literature as well as my hypothesis. Kay et al. Found isometric and eccentric contractions to be about equal in their MVC. Kaleo et al. Found isometric contractions to be slightly higher than eccentric contractions in their MVC, which is contradicting both Kay et al. And my own findings. Because of this contradiction, I believe that more research must be done to get definitive answers on isometric versus eccentric contractions. Clinically, we need to be able to differentiate between these contraction types and decide when they would be most appropriate for treating people of various injuries. Knowing how these different types of contractions recruit muscle motor units and their maximal voluntary contraction could also be very important in facilitating recovery of patients.